Welcome to Doctors Unbound, your show devoted to doctors who are, well, unbound by physician stereotypes. Get a behind-the-scenes look at doctors that are breaking the mold and breaking into the worlds of technology, writing, investing, politics, just to name a few. This is Doctors Unbound, where you'll hear from experts with the insights to help you go to the next level. Let's get this show started. Here is your host, Dr. Dave Draginas.
Good day, everybody. Welcome to another episode of the Doctors Unbound podcast. I want to start off with a thank you today. Thank you to everybody out there listening. I see the download numbers growing. I see the bump every Monday morning when we release a new episode. So thank you to all my wonderful listeners out there. I know you guys are listening to every episode. I've received messages from some of you thanking me for the show, telling me you're excited about the show, and I really do appreciate that. That really makes me want to work extra hard for this podcast. If you will, I'd like to ask something of you. I would love to get in touch with you. So if you've been listening to a few episodes, I would love to hear from you. You can reach me at doctorsunbound@gmail.com. So that's all one word, doctorsunbound@gmail.com. And really what I'd like to know is, what do you enjoy about the show? And also, if you have any suggestions for improvement. I'm always looking to make this show better. So if you have any suggestions there for me, I would be happy to hear them and also to connect with you. I'd love to know about you, know who you are. Tell me a little bit about yourself and what you hope to get out of this podcast. So thank you in advance to those that will be reaching out to me. Today, I am super excited to bring you another episode with a repurposed general surgeon, as he calls himself. This doctor is now a consultant, a speaker, and an award-winning author. We get deep into lots of interesting topics like why managing debt and having control over your finances is essential to a fulfilling career. Other takeaways that I'd like for you to get from this episode include the importance of figuring out why when considering a career change. Why do you want a career change? Getting down to the really deep issue there, so important. And also the importance of mindset and how he has repurposed his mission now that he has stopped practicing medicine this year. I am so grateful for this episode with Dr. Cory Fawcett. Welcome to another edition of the Doctors Unbound podcast. I am so excited because today we have Dr. Cory Fawcett, who is, as he calls himself, a repurposed general surgeon. He's also a consultant, speaker, and award-winning author. Dr. Fawcett, welcome to the show.
Hey, thanks for having me, David.
Absolutely. It's a pleasure to have you on. And reading through your bio, I've noticed that as of February of this year, you've kind of changed your career path. You've stopped practicing clinical medicine, if I'm correct. Can you tell us about that transition a little bit?
Well, I tell you, that was a wonderful day. Well, I had practiced in a single specialty, busy general surgery practice for 20 years and was ready to cut back and work part-time. But my partners and our contract didn't allow for part-time work. It was kind of a full-time or you're not in the group kind of thing. And so I had to do something different. And I retired from that group and began working like a locums at critical access hospitals nearby. So I would help out, like there's only one surgeon in town or two and they need a break. And so I would go work there, and I start out 2.5 weeks a month, cut down to about 2 weeks a month, then down to 1 week a month for the last 7 months. And then I was ready to let go of surgery. I was a little worried that I could do that and feel good about it and not miss it. But I think my ability to taper down, had I just quit, I think, from my busy practice and been done, I don't think I would have done well.
And why is that?
But that ability, because surgeons are pretty driven.
Right.
And I was going, 90 miles an hour in a full practice, and to go from 90 miles an hour to zero, I'm not sure how I would have done with that. What do I do with my time, kind of thing.
Right.
And given a 3-year period to slowly taper that down, 90, 80, 70, 60, down to where I wasn't working very much anymore, I think it made it very easy to let go at that point.
Okay.
And on February 20th, I turned in my pager for the last time, and am now doing full-time work as a writer, an author. I just released my 3rd book, and I'm teaching doctors personal finance and lifestyle things to make their life better. I think we all deserve to live a great life, and nobody ever teaches us how to do that in medical school. Nobody teaches us how to take care of our finances or get out of debt.
That's very true.
I'm trying to help doctors do that.
Very cool. And it sounds like you had been kind of planning this transition for some time.
I had a couple of years before I left the practice.
Mm-hmm.
I financially was ready to retire, and I had told my partner, I think I'm going to go ahead and retire this year. And my partner, the wise gentleman, said to me, well, what are you going to retire to?
Ah, yes.
Oh, well, I hadn't thought of that. I was just going to stop.
Mm-hmm.
And he said, all the doctors he's seen retire without a plan were all back to work in 6 months to a year because they got bored. That was kind of going back to what I said. I was worried about, can I go from 95 miles an hour to 0?
Right.
And I really hadn't thought of exactly what I'd do. I thought I would retire and then figure out what to do. But when he said that, it made me think, and I spent the next 2 years kind of looking into, well, what should I do with myself?
Right, because as you mentioned in your book, for most physicians, once you retire, after a year or so, it pretty much becomes permanent.
Yeah, there comes a point where people really don't want you back.
Mm-hmm.
I'm a surgeon. I mean, would you like a surgeon to come on board that hasn't operated for 3 years?
Well, yeah. I mean, there's a lot of things there to figuring out competence, skill, all that kind of stuff.
Yeah, so, when you make that plunge, you better be darn sure. And I thought it was great advice. What are you going to retire to? And so now I don't say that I retired. I say I repurposed.
Very
I'm a repurposed surgeon.
I think that's good for your mindset too.
Yeah, because you need a purpose.
Right.
If you retire without something to do, especially if you've been a very busy type A person, I think you're going to go stir crazy.
Mm-hmm.
And there will be some trouble. You're going to want to do something. Either that or your wife's going to kill you because you're driving her nuts.
Is there anything?
I don't know. What.
Having thought about it for some time, is there anything about this transition that has surprised you?
There was 2 things that I was super worried about.
Mm-hmm.
One was, would I be okay giving up surgery?
Right.
I mean, that is who I was. When I gave that up, would I have an identity crisis?
Mm-hmm.
That didn't happen. I was okay without it. And I totally blanked on what the second one I was going to say.
The second thing that
But
surprised
the thing
you? Yep.
Yeah, but the big thing that surprised me was how much sleep deprived I had been.
Ah.
I did not realize it until I had gone a few months of getting a regular night's sleep every night, how I felt and how things played out. That was a big surprise. I always thought I was just not a morning person. My wife was always up before me. On the weekends, I'd turn over and look, and she's gone. She's been up for an hour or 2 doing things. Well, I always thought that just because I'm a night owl and she's a morning person. But I think what it was I was chronically sleep deprived, and when given a chance to sleep in, I slept in.
Wow, I hadn't even thought about that.
After being off work for a while and sleeping every night, no more pages, no more nurse calls in the middle of the night, no more trips into the emergency room. After sleeping every night, now I was waking up before her.
Wow.
And it was a whole new thing, man. I didn't realize that there was this great morning that you could get up and do stuff. And I I always said, just get up, brush my teeth, go to work, because I slept the longest possible before I had to get up and run into the office. And I didn't realize how nice the morning can be.
I'm sure different energy levels.
There's a very different energy level when you get enough sleep.
Mm-hmm.
And I think we don't realize that we're chronically sleep deprived until later.
I think there's a lot of truth to that. So I do want to get a little bit more into your latest book, The Doctor's Guide to Smart Career Alternatives and Retirement. And what really impressed me about this book is how comprehensive it was. I thought I knew a thing or two about this topic, but there's definitely a lot that I learned. And right off the bat, there were some statistics in there that really got me thinking, were really profound. And I'm just going to read off these statistics, and maybe you can comment on them a little bit. But according to the 2016 survey of U.S. physicians by Merritt Hawkins, over the next 3 years, 14.4% of doctors will retire, 13.5% will switch to a non-clinical career, and 9.8% will cut back to part-time. That's like 38% of the physician workforce.
Yeah, 1/3. That kind of says that 1/3 of the doctors are disgruntled enough right now, they want something to change major in their practice.
Right. And I don't know what the numbers were like maybe 10 or 20 years ago, but this seems like a big number to me.
Well, I looked at the numbers a few years before those, and what's happening is they're just kind of slowly climbing.
Mm-hmm.
I think this group is up. And the funny is, I look at those, I did all three of those. I started cutting back to part-time. I began a non-clinical career as a coach and writer. And then I retired as a doctor, as a physician, seeing patients. So I kind of hit all three of those. So I don't know if the statistics puts me in one of those places or if I'm counted as three when that happens. But over the time, that's exactly what I did. As I slowly moved into something different, I kind of eased there, and I kind of crossed all three of those. But more than 1/3 of the doctors want something major to change in their practice right now.
What do you think it is? What do you think is driving this this attitude?
I think there's a lot of things that are kind of coming together.
Mm-hmm.
Doctors are no longer in control. They used to own a practice. I mean, most of the doctors used to own a private practice. They ran their practice.
Mm-hmm.
Today, most of the doctors are employed by somebody who's telling them what to do. And I don't think that goes over great in the long run with the type of people who want to become a physician.
Right.
That type of person is a take charge kind of personality in general. And you put a take charge personality under somebody else's thumb and they're not as happy.
Right.
So I think that's part of it. I think the government has certainly been interfering more and more every year in the practice of medicine.
Yeah.
I mean, now to get paid, you got to prove you did a good job.
Yeah, it's getting more onerous every year.
And it's hard to meet their proof requirements. Even if you're doing a good job, it's hard to just go through the motions they want you to go through to prove that that's true.
And it's getting more expensive.
One of the friends of mine, another general surgeon, said, every time there's a new rule, I got to work an extra half hour, but don't get paid more.
Yeah.
So I'm essentially getting a pay cut with every new rule.
Mm-hmm.
And so I think that's making doctors unhappy. I think the debt level to become a doctor is also a big factor.
Mm.
When you start your practice, I'm coaching some people that come to me and they're starting out $500,000 in the hole.
Right.
And that's how they start. I mean, and they're trying to live a life as if they're a millionaire.
True.
But they're a negative $500,000.
Right.
But they want to go on big vacations. They want this new car and this nice house, live a life of luxury, but their actual net worth is way in the hole, and they got a long ways to dig out.
You feel like you deserve it because you've gone through all that training, right?
Oh, I'm finally here now.
Right.
And that's why I wrote that second book, The Doctor's Guide to Eliminating Debt, was because there's a couple of unique things about doctors and their debt that is causing a problem.
Mm-hmm.
And one of those, I came up with the two new terms for those. One of those is called diabetic neuropathy.
Tell us what that is.
And that is, so every year you added more debt and nothing happened, right?
Mm-hmm.
So second year, okay, throw some more on the pile. And then, some guy doesn't come along with a baseball bat and beat your legs because you didn't pay him. Nothing happened. You didn't have to pay anything. Nobody came after you. So the next year you throw some more debt on the pile and nothing happens. And the next year you throw some more debt on the pile. And pretty soon you are totally numb to the effects of debt.
Yep.
It means nothing. You just throw some more on the pile. I'll take care of it later. That's the system to go through medical school. Throw more money on the pile. I'll take care of it later when I'm making the big bucks. And then you get diabetic neuropathy. And then when you get out and you're making the big bucks, since debt doesn't mean anything to you, you think nothing of going out and buying a Tesla. Oh, just put it on the pile. I'll borrow another $80,000 to get a nice car. I'll borrow another $500,000 to get that house over there. I can afford the payments. And I'll borrow. And pretty soon it catches up to you.
Yeah.
And if you get numb to debt, then every salesman who comes along, you don't think anything of just buying, oh yeah, I'll take that motor home. No problem. Just throw it on the pile. No big deal. And so you're just numb to that effects. The other term I coined in Eliminating Debt book was Alzheimer's dementia.
Tell us about that one.
And that is the process of forgetting what it was like to be debt-free.
Ah.
It's been so long since you had no debt. Debt has become just a part of your life now. And you don't even remember what debt-free looked like. You were probably a teenager the last time you were debt-free. And so you just totally have no concept anymore. I talk to people about paying cash for a car. Oh, nobody does that.
Right.
And their concept is that you can't buy a car without getting a car loan. Because they don't remember when they used to not have debt. They just think that's just the part of life now.
Yeah, that is very interesting. And I imagine that those attitudes about debt also affects, people when they want to consider career alternatives or retiring. Your options might be somewhat limited.
The retirement part is very hurtful. There are a lot of doctors who I counsel that are approaching retirement with an $800,000 mortgage. And it works out okay when you've got this high income coming in, but to support an $800,000 mortgage in retirement, you need an extra $2.5 million in your retirement account.
Wow, that's a lot of money.
And so if you just keep, how long does it take you to save $2.5 million versus how long would it take you to just pay off the $800,000? One doctor, for example, came to me once, and he was going to retire in 5 years, and he wanted me to look over his numbers and say, do you think that I'm on track for that? And I looked over everything. I said, you realize if you took this money you have right here and you paid off your house, you could retire now. The only reason you're still working is to get enough money in there so that your retirement plan will make your house payment. He had never even thought of removing the debt. And so when you come into the retirement age carrying debt, it is a big burden to shoulder in that era, and that's hurting a lot of people who are looking at wanting to retire because they're looking at having to service the debt they're going to carry forward into their retirement.
Very true. So what did that doctor do?
He retired a month later.
So he made the change?
He made the change, retired, and moved.
Gotcha.
I mean, he made a big change in his life.
He was ready.
He was ready, but he didn't realize that he could do it now. He thought 5 years was the best he could do.
I see.
But he wasn't thinking in terms of, what if I didn't have debt? What would that be?
Mm-hmm.
And he had enough money to pay off his house, but everybody had always been telling him, oh, you want to keep that mortgage payment because it's a good tax write-off or it's low interest or whatever. But that mortgage payment that's a great tax write-off and low interest was keeping him from retiring.
Mm-hmm. I see.
He just got rid of it. He could retire now. So the debt is hurting. And if you want to change careers, often there is going to be a startup time, depending on what choice you make. Some things you can walk right into a salary and you're just fine. But if you have a huge debt from medical school that you've never taken care of yet, and you want to change careers to something that might pay less, that might be very discouraging.
Yeah, very
for
true.
you as well. And having to deal with that might keep you in medicine when you want to leave.
Mm-hmm.
Because you're afraid if you leave, you can't make these payments.
Very true. So I want to back up just a little bit. One thing that I liked about your book here is that it was very comprehensive, and it was really systematic about approaching, this topic. And one thing that you lead with is knowing why you want to change if you're considering a career alternative. So can you talk a little bit about that?
Well, part of that was it came out of my partner saying, what are you going to retire to?
Mm-hmm.
And I got to thinking about that, and what I also began to think about was not only what am I going to retire to, but why am I leaving medicine? And a lot of people are leaving medicine for the wrong reason. And if you do that, and you don't figure out what your reason is, you run the risk of carrying that same problem into the next profession that you do, and you'll be just as unhappy there.
Yeah.
So, for instance, some of the things I mentioned in the book was, what if you want to travel before you get too old? Well, you don't have to retire to travel. What if you cut back to half time and travel the other half? I mean, you don't have to. If you just quit because you want to travel, you may find when you get there, it wasn't what you were after. Now you want to go back to work because now you've traveled for 6 months and you got that out of your system and you're ready to go back to work. You left for the wrong reason.
Mm.
I mean, a good reason to leave is something like I did here, where I was seeking a different mission. I have a new plan for my life. I want to do this.
Gotcha.
I have something to retire to. That's a good move to make. If you say, for instance, I worked for 30 years and I'm done now. Okay, but where'd the 30 years come from? Why are you done now? What? I think you got to ask the question why. And it's not the first answer that you give. Ask why again and why again. Because it's going to be about the third or fourth time you ask yourself that question that you come to the real reason you want to quit.
Yeah, very true. I think I heard that somewhere else, and I can't remember where, but the idea of drilling down, keep asking why 3-4 times to really drill down to the real reason. That's very powerful.
A big one that people say is, I don't like what I'm doing anymore. Well, why? Well, because I hate medical records. Well, why? Well, because I don't understand how this works. Why? Well, because I really never took the time to learn. So if you took the time and learned how to use the medical records well, would you like to practice again? So if you're quitting just because you don't like medical records, maybe what you're really quitting because is you don't want to put any extra time into learning something new. And so if you can really beat down, well, why do I really want to leave this? Maybe you can solve the real problem and you learn how to use the medical records, or you hire a medical scribe to take care of it for you, and you solve that problem, and suddenly you like medicine again, and you can practice another 5 years. You don't have to quit because you were quitting for the wrong reason. I think totally need to understand why you want to quit and make sure it's legit.
Yeah, I think that's very, very powerful to understand your own why. I mean, it'll help you be more happy, as you put it.
Well, there's a story about me and why I went through this.
Mm-hmm.
And the story is in the book. Many years ago, this was long before I actually retired. I was probably, I'm going to guess, 15 years into practice.
Okay.
And I was very, very unhappy, and I was ready to quit. And I was a worship leader at the church. I'm a musician. And I played, and they had an opening for a new worship leader because the old one had left, and they were going to hire a new one. And I thought, is this my opening? I'm hating medicine. I want to leave medicine, and I should just go and be the worship leader. do that instead. I'd love that.
Mm-hmm.
So I was teaching a class at the time. It was a Bible study class. And one of the guys in the class said, are you being called to retire? And I hadn't thought about that. I just was mad and wanted to retire. I hate this job. I want to get out of here.
Uh-huh.
And he said, yeah, but are you being called to do that? And I hadn't thought about that. So the group actually, they prayed about that in the next week, before we met again, that I would know the answer to that question. Am I being called to retire? Well, that became the greatest week of medicine I ever had.
Wow.
I walked down the hall, and suddenly there was a code blue right there, and I walked in and saved somebody's life. I hadn't saved somebody's life directly in a long time. The ER doctor calls me and says, oh, you're the only guy who does this in town. Could you please come and help me? I know you're not on call today, but I sure appreciate you being here. I hadn't heard people say they appreciated me being here in a long time. Patients were saying, thank you for being here. I had the most positive week in my life in medicine that week. And it came very clear to me, I am not being called to retire. Something else is wrong. So we got back that next week, and everybody said, so what did you find out? I said, well, I'm pretty sure I'm not being called to retire. That's not the message I'm getting.
Uh-huh.
And the other guy said, well, maybe you just need a little sabbatical. You just need a break. So
Yeah.
I took a sabbatical. I looked in my schedule, found where there was an opening, and I told the office manager I want 30 days off right there. And so I didn't, cancel patients. I just found it where they were booked through to here, leave it open. I'm going to take a... So during that month, I was going to try and figure out what it was that was wrong. And I was also going to read through the New Testament.
Uh-huh.
Well, the first day of reading, like a neon light came right out of the pages at me, and it said, bitterness. My problem was, I was mad at somebody at the hospital because they had done something that really made me mad that year before. And every time I saw the hospital, it reminded me of this, that I was bitter at them. Every time I saw a patient, it was reminding me. Every time I saw my office, every time I thought about medicine, every time I saw a book, no matter what I did about medicine, it just kept bringing up this bile in my mouth.
Wow.
I was mad at this guy. And so I did a little study on forgiveness and bitterness and what to do about it. Forgiveness was the answer. I forgave them, made a big donation to the hospital, said, this is over with. I'm no longer going to worry about that. It was kind of like I was drinking poison, wishing he would die.
Mm-hmm.
And then, now that I was no longer bitter with him, I was very happy to go back to work, and I enjoyed my practice again. Now, had I quit because I was upset and I didn't like this medicine anymore, had I quit, I would have gone on to whatever I did next, still bitter. But because I drilled down and figured out why I wanted to quit, I found a solution to that, and then I no longer wanted to quit. So I saved myself from making a big mistake by quitting for the wrong reason.
And then allowing that, that bitterness and that, that issue with that person to, affect you for much longer.
It affected me until that time. It was almost a year that affected me.
Mm-hmm.
And to imagine how much joy I lost in my life during that year because of this.
Well, thank you for sharing that. That's very powerful. I think we can all learn something from that. I'm going to transition a little bit. So let's say that somebody goes through their whys and they figure that what they need is to churn to something that's more of a non-clinical career. Can you talk a little bit about how they might go about that, or the different things that are available, resources available for them to seek that out?
Sure. First of all, most doctors have the false impression that the only thing they're trained to do is medicine. And that's really not true. The thing is by the time you have completed medical school and your residency, you have a tremendous number of special skills besides medicine. There's leadership skills. There's thought process skills, problem-solving skills, people skills. I mean, you have a lot of skills that a lot of different professions need. And when you tie that to the initials at the end of your name, because you have a doctor's degree, you're a pretty good commodity out in the market.
Mm-hmm.
So medicine isn't the only thing that you need to think about. You can do lots of different things that are totally outside of medicine as well. In fact, there's actually a meeting. I'm actually on my way. I'm a mentor at this meeting that SEAK, S-E-A-K, SEAK Incorporated puts on, called Non-Clinical Careers for Physicians.
Uh-huh.
And when you get to this meeting, it's a weekend of people talking to you about what different things you can do with your life as a physician. And there's a bunch of recruiters there who are actually looking for physicians to leave medicine and come work for them. I mean, there'll be a bunch of people sign deals right there at the meeting with some recruiter from some other company.
Wow, hot commodity.
They want you guys. So they know there's 500 people in this room that are physicians that want to leave, and we want one. And they're there looking for you. So I mean, there's a whole business been set up by those guys just to teach doctors other things. So, for example, there's the whole field of medical informatics. We all hate the electronic health records. Okay?
Right.
Well, why do we hate it? Well, we hate it because it wasn't designed for doctors and by doctors. Well, that means that there's room for a doctor to get involved in that to help teach doctors how to use this better. So there's the whole electronic health records industry that needs some physicians in it. There's diagnostics, there's databases, laboratory stuff. There's a bunch of different programs out there that need input from doctors. Education, research, teaching. I do education now. I teach other doctors. And the reason they listen to me is because I'm a doctor too. And so they relate. There's kind of a bond. It's like, well, you've gone through what I've gone through. I remember one doctor contacted me and basically said, help. And I said, what got you to me? And they said, well, I'm $500,000 in debt. And when I read your book, I realized you paid off $500,000 in debt. And if you can do it, you can show me how to do it. And so there's a relatability.
For sure.
That happens there. There's the whole field of medical communications. I mean, if you think about all of the social media stuff that's going on right now.
Right.
And the way the medical community is trying to tie into social media. If you love playing with social media and you're a doctor, you've got a shoehorn right into that industry to where you could work with some of these different companies that are trying to develop things. For example, I just saw an app pop up that you just plug into your phone to check your blood sugar.
Uh-huh.
I'll bet you there was a physician involved in that whole process of getting that thing to market.
Oh, yeah, for sure.
Because somebody needed to know, how do we make this relatable so that it's going to be clinically relevant? The whole pharmaceutical industry wants to have doctors involved. Every time they do a drug trial, they need somebody to design that trial that knows what they're doing with patients.
Yeah, for sure.
So there is a whole bunch of different fields, including, say, like running a hospital. It's interesting that there's some statistics in the book that hospitals that are run by physicians instead of MBAs
Mm-hmm.
Have a better track record of health and safety and such. They end up being, there are more doctor-run places in the top-performing hospitals than proportionally there should be.
And I'm guessing there are not as many doctors in those leadership positions.
There's very few, but what few are in there tend to take their company to the top.
Very impressive.
So, I mean, because this industry, what it takes between a doctor and a patient. And when I talked to one of a CEO of a small hospital who was an emergency room physician, and she told me that, when there's something wrong on the floor, I can go in, change into my scrubs, and go in with the nurses, with the patients, and deal with something and see how it works. When there's something wrong in the OR, I scrub into the case. I'm a doctor. I could do this. I can scrub right into the case and see what's going on and an MBA can't do that.
Yeah, that's powerful insight right there.
And so you have insight others don't have. You have advantages others don't have. You have so many options available to you besides just clinical medicine.
Yeah, for sure. I think sometimes, we get so specialized and we get so focused on our day-to-day that we kind of lose sight of kind of the bigger picture that you just painted there, that we do have all these other skills and, there are other options out there.
And, a whole other section that I talk about in the book is not necessarily changing to a non-clinical career when you're unhappy, but there are changes that you can make in your own clinical career to make you better.
Right.
Better suited, more happy with your practice. For example, if you're a primary care doctor and you really hate dealing with a particular problem, let's say back pain. You just hate back pain. You see a back pain patient on the list and it makes the hair on the back of your neck stand up. And, oh, no, they're back again. I hate this back pain. Well, why don't you just remove back pain from your practice? If there's a particular thing you just don't like, stop treating that thing. Send that to somebody who likes back pain.
Yeah, that's right.
I did that in my practice many years ago. I'm a general surgeon in a small town, and we did vascular surgery and we did thoracic surgery. I didn't like vascular or thoracic surgery. I did it because my partners did it, and I did it because it was very lucrative, and I really hated to give up the best paying procedures that I had. I had good results, but I didn't like it. And it was only after I became debt-free that I felt like I had the courage to give up my highest paying diagnosis. And when I did, I found two things interesting. Number one, I liked my practice way better because now I wasn't doing something I didn't like.
Right.
And number two, my income did not drop.
Huh, that's interesting.
I was so afraid to make the move because my income would drop by giving up these lucrative things. But what I found happened was my partner really loved doing them. So those things were transferred over to his box. And that meant he had to give up something to take them because he was full. So stuff I liked got moved from his box to my box. So I got to do more things that I liked, and I ended up, it took care of the holes that the vascular and thoracic surgeon made, and I didn't drop my income. It was totally a surprise to me. But you can change your practice a little bit to make it one you like. Maybe it's not drop one diagnosis you don't like. Maybe it's only see one diagnosis that you do like.
Well, we've only scratched the surface of what you've got here in this latest book, Smart Career Alternatives in Retirement. I would definitely recommend it for those that are interested in this kind of stuff. Could you, as we wrap this up, maybe just tell us a little bit about the resources that you provide for physicians? Now, you mentioned a little bit about coaching and things like that. What kind of things are you doing for physicians besides the books right now?
Well, I have a website called A Prescription for Financial Success, and it can be found at Dr. Cory S. Fawcett. That's Dr., not the whole word, CorySFawcett.com. And on that site, I have a blog. So once a week, I'm putting out some interesting thing to help you either financially or to have a better life. So that's totally free for people. Just come sign up for my blog and get some free information on how to have a better life as a doctor or how to have your finances work out better. I'm on Facebook, Dr. Cory S. Fawcett, and I have a Facebook page there. Don't look for my personal one because I won't like you on that one because that's just for my friends and relatives.
Right.
Go to the business one. That'll show three of my three books on the top of the page there. And in fact, right now, I'm actually blogging my trip as I go across the country on Route 66. My wife and I are living in our RV because now I'm not tied to a hospital. I just need a computer and a phone. We're traveling up Route 66 on the way to that SEEK conference where I'm going to be mentoring doctors.
Well, that is so cool. Definitely going to check you out on your blog, and we'll link to the blog in the show notes as well.
And then I'm on Twitter, Dr. Cory S. Fawcett, and on LinkedIn as well. Those are the places you can find me. And if you're looking for help, one-on-one help on getting yourself out of debt or figuring out how to work your finances better, be happy to do that. I'm also a certified high-performance coach. So if you're looking to take whatever you're after to the next level, if you think whatever you're doing is a 7 and you want to be a 9, that's what a high-performance coach does. That's a slightly different program that I do for people to help you improve whatever it is you're after. You want to be a better doctor, you want to be a better husband, you want to be a better wife, you want to be a better father, you want to be a better businessman, you want high-performance coaching. And I'm going to come up shortly. There's going to be some courses that are available that you can get through my website where you can take miniature courses on selected topics. The one that should be coming out soon is on doing locum tenens and how to make that more successful.
Very cool. Sounds like there's a lot going on.
There is a lot going on, almost more than I wanted in my repurposing era. But it's really fun to be able to do a job as a doctor that I can do from my motorhome driving up Route 66. I mean, what a different life I lead now.
Well, I'll borrow this from your book, and it stuck with me. It said, "Are you making a living or making a life?" And it sounds that you're living it out and you're making a life. So thank you for coming on the podcast and sharing so much with us today.
You're welcome. I had a lot of fun.
Awesome. Till the next episode.
Thank you for listening to Doctors Unbound podcast. Remember to head over to doctorsunbound.com to access all the show notes and resources discussed in this episode. Now, it's your turn to be unbound.